Justin and I are going to talk about the topics of microplastics. Everyone now keeps talking about where they're finding microplastics, how it could potentially be harmful, especially in the realm of reproductive medicine. This is the Man Up Podcast, a doctor's guide to men's health. Each week on the podcast, we interview the top specialists of the field on various topics of men's health. If you have questions that you are too afraid to ask, we have the answers. This week, our episode is titled, Should We Be Scared of Microplastics? My name is Dr. Kevin Chu, and I'm joined as always with my co-host, Dr. Justin Dubin. Justin, this was a great topic that we talked about, yeah?
Oh, yeah. This is a very hot topic. We decided to step on the mics ourselves and discuss as men's health specialists. You know, Kevin and I, we do specialize in testosterone, fertility, erectile dysfunctions. And there's been a lot of papers coming out about finding microplastics in pretty much all of those things, right? In your testicles, in your penis. And we talk a little bit about the brain, but we don't really know the implications of that one. But it's a very timely topic. And it seems like people are starting to really worry about finding microplastics everywhere.
You're reading about this everywhere, right? You're getting news article that says we are having massive plastic consumptions that's being found in all parts of our body. And, you know, there is a degree that we talk about that, hey, we don't want to be fear mongers here, right? We don't.
Right.
We don't want to be like, hey, plastic is, ruining our lives. Yeah, it's actually had some great benefits for us. But again, there is good data on a lot of stuff that just wants to make you think. And that's what this whole episode is all about.
Yeah, it's a good point, right? We do not know the true implications of what microplastics doing in your body, what they're doing, how they're affecting you, if anything. But obviously, in this episode, there's a lot to ponder where you have some foreign object in places where they shouldn't be. And that's always concerning. And you know, we talk about it a lot. We make some, you know, implications that we are making very clear are implications, not fact. But there are definitely things to think about. And as more research, you know, is going to come out, because obviously this has inspired a lot of intrigue, and I'm sure with intrigue there will be more studies. It's going to be an interesting next few years, and to understand how microplastics are going to impact our health.
And Justin and I are taking this kind of rather seriously. Hey, again, not saying that this is absolute, but we've made some life adjustments. And tune into our socials this week. We're going to kind of share some of that stuff. So just something to pay attention to. But otherwise, Justin, I think it's a great episode. We should jump straight into this.
Yeah, I say let's do it. As always, guys, thanks for listening. Please download, subscribe on all podcasting platforms. Give us a review is always appreciated. Leave a comment, and that's always appreciated. YouTube. We're really trying to push our YouTube. We have really great quality cameras. Kevin's a good-looking guy. I'm a good-looking guy. And so you get to see our beautiful faces. And if you haven't seen what we look like, you know, YouTube's a good opportunity. And I think that you can really the YouTube, the video is great. So just check that out as well. Subscribe there. Other than that, let's get right into it. Let's talk microplastics.
Or if our faces aren't doing it for you guys, just keep listening to the podcast. All right, guys, enjoy. All right, listeners, you're in for a treat today. Justin and I are going to talk about the topics of microplastics. Now, I'm sure you've turned on the news, you've listened to some podcasts, or maybe you've been listening to the radio, and everyone now keeps talking about where they're finding microplastics, how it could potentially be harmful. So Justin and I have, especially in the realm of reproductive medicine, in particular on the male side, we're going to kind of do a kind of deep dive into what's known about microplastics and its effect on, male reproductive potential. So Justin, exciting topic. Why don't you start off and just kind of tell listeners what exactly are microplastics?
So microplastics are these small synthetic materials with a high polymer content. They're solid particles, and by definition, to be micro, they're smaller than 5 millimeters or millimeters, I believe.
They're tiny.
Tiny. And they're insoluble in water and non-degradable. They're easily introduced into the environment and they persist there because of that for a long time. And, you know, the thing about microplastics is that they're pretty much found in almost everything that we use. They're found in synthetic clothing, wet wipes, tea bags, laundry, dishwasher pods, paper takeaway cups, glitter, facial cleansers, cosmetics, some medications, industrial paints, other things like ordinary dust, bottled water, various foods, packaging for foods. So there and
It's
packages for
everywhere.
beverages.
It's everywhere.
So it's something that is literally ubiquitous. It is something that is in everything that we're doing, everything that we're wearing, everything that we're consuming at this point. So the question then becomes like, all this exposure, is it causing anything? Are we actually having it in our bodies? Are we finding it in our bodies? Now, Kevin, there's been a lot of research for the last few years, but it's really started to ramp up. Now, you know, what parts of the body in humans have we found microplastics to be in?
So before we get to that, Justin, kind of to
Yeah.
rehash what we're talking about, how small the particle is. The reason why it can be kind of scary is usually we have great filtration systems to really kind of keep things out of our water supply. So we're talking about things that are smaller than what filters can generally kind of sift out. I think this all really started, I think, a few years ago when on the news they talked about, there's exfoliating, kind of things for your face to kind of have those
Yeah.
small beads. Those small beads are actually, in essence, microplastics. And those things were going into our, you'd wash it off your face, clean off all the dry skin, but it was going straight into into the pipes. And so that was like one of the first things where they were like, hey, guys should probably stop using these exfoliating washes because we're really seeding the environment. So that's kind of the thing with microplastics that's a bit worrisome. Now, you know, scientists have looked to see where in the body have they been found. They've been found in the lungs. You can inhale these microplastics. They've been found in our GI system, so in our intestines, in our colon. Interestingly, most recently, some of the more fascinating areas that they've been looking at um, in terms of microplastics is that in patients who have colon cancer, there is a higher amount of microplastics versus patients without. And the thought process that this is causing inflammation, disrupting the barrier, and that this is why we're potentially again seeing, earlier colon cancer or higher degrees amounts of incidence of colon cancer. So again, that's another area that's found. And where we're going to talk about today in the reproductive system, it's been found in the testis, it's been found in the prostate,
It's been found in the semen.
it's been found in semen. So it's everywhere, right, Justin?
It's pretty scary, and when we're talking about these things, like you said, there's a lot of implications that I think we're going to go into. Obviously, as men's health specialists, we're really going to focus on reproductive health and potentially, testosterone levels and things like that. But this is something that I think every aspect of medicine is currently interested in. And the question, like you said, is all of this exposure, what happens? Is this, and I think a lot of people are asking, is this like our cigarettes, right?
Right.
Like we didn't know for a long time, a lot of people were smoking cigarettes, kids were smoking cigarettes, cigarettes were doctor
In the
approved,
operating
you
room,
know,
hit up a
yeah,
cigarette.
people were ripping cigs while talking to a pregnant woman, and pregnant
Right.
women were smoking
Right.
cigs. So microplastics in combination, and we'll talk about endocrine disrupting chemicals, of course, as we have in the past, which is also part of the picture. Are these our, modern day health risk across our generation? I think obviously a lot of things we're going to discuss today is speculative. I mean, there's some data, but there's not great data on long-term stuff. So, we're very, very early on in this topic and early on in this research. Remember, we're starting to only detect these things. So we don't really know the long-term implications of what they are yet. I think some people fear things, But once again, we're not here to scare people. We're here to inform you.
That's an excellent point. Justin and I have looked at all this data, and it's important that it's early on, but it also at the same time doesn't mean like, hey, let's not think about it or do things in our daily life that may, let's say, decrease our microplastic exposure because look, some of the early stuff is kind of compelling. And, a lot of the evidence is cumulative effects. So, why not? And then, I think Justin and I would talk a little later because we've been talking about this on, privately for a while. There are things that
Yeah.
we've done a little bit more on our own, on our daily lives, just to kind of decrease uses of plastic. But we'll get to that later. But, Justin, there is one an anatomical body part that I actually forgot to mention. But they recently just published on it, Justin, right? That there was a body part that a lot of guys find very important that they found some microplastics in. And what body part was that?
I think the penis. Is that what we're talking about?
Oof. It was found in the penis. That's correct. Yeah, it actually was done at our alma mater at the University of Miami. They did a study where they actually took some corporal tissue during a penile prosthetic surgery that Justin and I do. While we're in there, you kind of can get into the inside corpus cavernosum, and they took a little piece. They ran. I believe they looked at it under an electron microscope, and they saw many different types of microplastics in there.
Yeah. So, what's interesting about this is the microplastics they found were predominantly those of polyethylene, PET, terephthalate. I can't really say that word, and polypropylene. And just to, give you a summary of what these microplastics are, I'm going to call that one PET, polyethylene terephthalate. It's the most common thermoplastic polymer resin, and it's used for fibers for clothing, for liquids and foods, and for manufacturing. It's in combination with glass fiber for engineering resins. It's really the main ingredient for most clear plastic containers used for beverages and condiments worldwide. And so it is a pretty prevalent plastic in our lives, and it's not surprising why it was the most commonly seen microplastic in the penis tissue. The other one, polypropylene, is really used for bottles, jars, yogurt containers, hot beverage cups, and food packaging. It's also really big in the automotive industry to produce batteries, bumpers, instrument panels, interior elements, and door trims.
We're surrounded by this stuff, man.
We are surrounded by these two microplastics for sure. Now, the question is, can microplastics in our penis impact our penis function? And I think when you break down the question whether microplastics in your penis can impact your penis's function, I think you have to look at it in a way of several things, right? When we've talked about this before, in order to get a good erection, you need 5 things. You need good blood flow. You need good nerves. You need good testosterone levels. You need to be aroused, and you need to be in a good state of mind. And when you think about blood flow and you think about nerves, could these things compromise communication in terms of blood flow, or can compromise maybe how nerves interact? I'm not really sure. It's still up for grabs. But I will say having healthy tissue in your penis probably includes not having foreign objects in it. So, but and to be fair, in this study, remember, this study was done on 6 men, all of whom have erectile dysfunction, potentially for other reasons, most likely for other reasons. And if you're getting a penile implant, you're probably getting you probably have severe erectile dysfunction. Are the microplastics higher in these people because they have erectile dysfunction, or do they have erectile dysfunction and there's a correlation with the high levels of microplastics? That we do not know, but I can almost guarantee that for men like this, their source of erectile dysfunction was not the microplastics. What do you think, Kev?
I absolutely agree with you. I don't think there's any evidence. This paper purely just showed that, hey, another, you know, organ that we're finding microplastics in, there's no correlation, no causative effects that's being inferred here at all. Just again, another interesting place that we're finding it. And, the microplastics are being carried in the blood. Your penis needs a lot of blood to work well. And so, we're not surprised that we're seeing it. This paper just kind of shows that, hey, look, all the end organs are another one added to the list, that we're basically seeing microplastics residing in it. Now, I think a little bit more of the interesting one that we'll kind of get to right now is about microplastics in the testis. Now, why would microplastics in the testis be interesting for us? Well, testis is the main area or the primary area for where your sperm form. Your sperm form and live in the testis. And so if microplastics have the potential to, cause inflammation, potentially cause oxidative stress, this could be a big problem, right, Justin? Let's start with oxidative stress. Is oxidative stress a potential, cause of male infertility?
Oh, absolutely. I mean, one of the things we've talked about a lot in our fertility episodes is this idea of the environment of the sperm, and that's where your lifestyle can really impact your fertility. Right? We talk about things like hot tub, sauna, steam room, jacuzzis, avoiding wet heat. We talk about cigarette smoking, vaping, marijuana as potential issues
Right.
that can compromise the environment of your sperm. We talk about endocrine disrupting chemicals that can potentially impact the environment of your sperm. We talk about high DNA fragmentation score, things from your varicoceles that can create a less favorable environment. So you're right. Now, if microplastics can get into your testicle and they're creating inflammation, it can definitely be concerning. That could it play a role in compromising sperm quality or sperm development, or impact sperm that is already made in terms of those fractionation of your DNA?
You're absolutely correct. And real interestingly, there's this recent study out of New Mexico that basically showed that they found presence of microplastics in canine and human testes. Now, just to stress, this is not the only one. There are multiple studies
There's
where they've
several in
shown
China as
in
well.
China, yeah, China's actually been doing quite a bit of work on this, where in the seminiferous tubules, when they took a look at it, there was microplastics. So a recent study out of New Mexico basically showed the presence of both microplastics in canine and human testis. Now, one of the observations they had was that there was a negative correlation between specific polymers such as PVC and polyethylene and the normalized weight of the testis. So, pretty much in, straight terms, basically, the more PVC or more PE they were finding, the lesser weight of the testis that was being observed. So you can infer that, technically there was lower amounts of sperm production being had in these testis.
Potentially, right.
Potentially. Again, all potentially, of course, potentially. China has actually done quite a few studies on microplastics, and they basically detected it in both testis and semen. Justin, what did they see in the semen, basically, from these studies?
So that there was a significant abundance in the testicles, and these in the semen they mostly found polystyrene and polyethylene and polyvinyl chloride, which is PVC. So once again, there has been some studies in determining the quality of the sperm and microplastics, but Kevin and I have reviewed the data, and we're a little iffy on whether the data is actually good or not. So we're not really going to comment on some of it.
Right.
But I do think that the study out of New Mexico, like you inferred, when we assess men for fertility, one of the big things that we look at is testicle size. Now, it kind of makes sense if, intuitively, if your testicles are smaller than they should be, you're probably not functioning as well as they need to be. Now, in this study, they did say that the testicles were smaller in men that had, higher levels of the um, microplastics. So that's obviously concerning and has some potential implications on functionality. But once again, all of this data, while concerning, of course, the presence of microplastics in your semen and in your testicle is concerning, but we really, really don't know the full impact on our health at this time.
I mean, there's a lot of hypotheses of how this is, how microplastics are causing, potential impacts on your sperm parameters. One interesting thing I actually came across, Justin, just to think about. So if you're finding microplastics in the testis, the sperm still has to kind of carry its way out, go through through the vas deferens, pass through, you're going through the prostate, right?
Right.
Interestingly, you're finding microplastics in all these areas. So you could be carrying them out as you're coming out, and it could be causing inflammation when it's in the, when it's getting into the vagina. There's all sorts of implications of what this could be causing, but again, very early on having any sort of definitive evidence. But I think there's some really interesting female infertility stuff. I don't think we went over that, but I think there's some interesting stuff out there too.
Yeah, I mean, I will be. I mean, I think that in general, the female fertility side is much more researched than the
Right.
male side.
Right.
It's one of the few. It's one of the actual few specialties that the female side is actually very much better research when we talk about fertility, and rightfully so. They have but I think it's starting to come back on the male fertility side in terms of how these things can impact us.
Right.
And you bring up an excellent point because all the time, I mean, we do have newer studies to assess the environmental impact that it has on sperm quality. Now, one of the things I've mentioned DNA fragmentation. Just to clarify what that is, it is the idea basically that the sperm is made, it's normal, it actually has a good function, it's able to do its job. And when a sperm is made, it's made in the testicle. The testicle has this testes blood barrier, and most, bad things cannot get into the testicle. So the sperm is safe. However, when it in order to develop, it leaves the testicle and it goes into the part of the testicle called the epididymis, where it matures. It can get motility. It learns how to swim, and it becomes its final form. During that time, you're not in that protected area, and it can actually then really get exposed to this less favorable environment, whether it's smoking, vaping, marijuana, varicocele, potentially endocrine disrupting chemicals. All these kinds of things can then take a sperm that is essentially normal and functional and do, damage to it, preventing it from achieving its goal, which is pregnancy. Now, we do see this and we understand this to often impact recurrent pregnancy loss. Oftentimes, we don't know what we don't know in terms of whether a baby was able to be born in the first place, but oftentimes we see this with early miscarriages or in IVF. And that's usually the time where we explore these things. And, we are testing it more. It's become more of a hot topic in the last, I'd say, 5 years. So this is just another factor for us to potentially consider.
Right.
And what's more concerning is if you think about what I had said, a lot of the data shows that the testicle is protective of sperm. And we have data showing that DNA fragmentation really doesn't happen to sperm in the testicle. And how we overcome this sometimes is we actually, biopsy and extract sperm directly from the testicle and use it for IVF. Now, if we're finding microplastics in the testicle, are we potentially compromising that safe space
I love that.
for sperm to develop?
I love that
I
because
don't know.
one of the papers I did come across. So let's look. That's basically that's data out there, right? So
Right.
let's just talk on this stuff. So one of the interesting things I read, Justin, was that microplastics can disrupt this very important blood testis barrier. Okay, very interesting. There's two barriers that are really important in the body where there's actually an added boundary to protect certain things from coming through, especially with certain size. Blood brain barrier, that's one very important area where the brain keeps a lot of the stuff that you don't want getting in there, and the testis as well. Now, Justin, I'll say it is kind of debatable. There's talks of like anti-sperm antibodies whenever you kind of
Right.
disrupt these barriers. Um, and I don't think we're going to really get into that. But you bring up such a good point, though. Let's say the blood testis barrier has been disrupted because the microplastics have kind of messed up this barrier, which they've kind of talked about with colon cancer. Like it disrupted like the basement membranes on those things and caused inflammation, yada yada yada. So interestingly, now this cumulative effect may cause this protected microenvironment where, like you said, where it's kind of protected. It is early stages of sperm, but it's protected from like the usual exposures that we get. It's been kind of our potential backup, just like you said, we
Right.
go into biopsy. And now, you know, we've been assuming that it's always been fine, but now maybe, microplastics are showing increasing accumulations in bodies since the 1950s. Maybe we're just seeing that now. I don't know. I'm just taking, just talking out.
Yeah, no, it is like, when you take a safe space and it's no longer safe, that becomes a problem. And we know that it can go into the brain, right? I think you said it before. There's a lot of data showing that
Right.
microplastics have been found in human brains. So it's not surprising when we're taking the two safest blood barriers out there to really, and its goal is to, protect our testicles, which are our future genetic,
Yes.
coding, and
Yes.
then our brain, which is our current way to survive, are two most important biological factors. And we are now saying, oh shit, you know, microplastics is going in those things. That's probably not good. And it is concerning when you look at it that way, because where's our safe space if we need to? Where's our backup? And hopefully, I mean, listen, we've done sperm extractions, and the success is high, right? We have
Yeah.
lots of data, years
Right.
and years of data.
Of course.
There's no reason to believe that that's changing anytime soon, and we're not doomsday prophesizing by any degree, but just the idea that something as protected as these two things have these things in them, there's potential big time implications, because I don't care what the object is, too much can do something, right? There must theoretically be a threshold for these things to impact you.
I completely agree. And we're going to talk a little bit about if these microplastics are actually endocrine disrupting. We'll get to that. But Justin, at this segue, let's talk. We've gone through all this research. We've talked about it for a couple of years. We've been talking about this for a while.
Yeah.
There are things on an everyday basis now that I feel like I personally have done now to try to decrease my plastic consumption. All right.
Yeah.
And one of them, I will tell you, I drink a lot less. I used to have just bottled water around just because it's sometimes easier to just drink out of. But I'm actually really cognizant of trying to not drink out of bottled water.
100% same thing. My sister was over the other day, and she's like, "Hey, where's your bottled water?" I was like, "Oh, I don't buy that anymore. I
Yeah.
just use a filter." So I've been using a filter since, honestly, our episode with Swan. So
Yeah.
I no longer use plastic bottles. I use all of like the aluminum, bottles
Yes.
that I put ice in, I put water
Yeah.
in, and that's when I'm thirsty. I fill them up through the filters. So I stopped that. I think I've mentioned it before, I don't really use plastic to store like leftover foods or anything like that. I purchase all glass. So I'm doing that. What else are you doing?
Well, the one thing that you crushed my soul with, you sent me, I think it was an IG reel, where it was pretty, it was factual in saying that aluminum cans actually on the inside are
Yeah.
lined with some form of plastic, which is unreal to me. I'm like, oh, this is an aluminum can. So I drink a lot of LaCroix. I drink a lot of like
Oh, I love
sparkling.
LaCroix.
I
Shout
love
out LaCroix,
LaCroix. I mean,
sponsor us.
Kirkland sparkling water, whatever it is, love it. But that I've also been a little bit more cognizant. I'll be like, I can't be slamming down like 4 of these a day.
But that's the problem. It's literally in everything. Like
Right.
what beverage are you going to purchase that's not in, you have to go classic Coke or Diet Coke because they're glass bottles. Like everything else,
Wait, so let
like
me ask
maybe
you: for your filtered water, is it in?
it's
You
in a
use
Brita.
Brita?
It's
Yeah, same
fucked.
here.
It's in a Brita. I was like, oh fuck, it's in a plastic thing. So I don't know. I can't avoid it. I can't even get out of it.
That's
I
so
know. I
interesting,
know it's
though.
so
We're
dumb.
so
I'm like,
dependent.
oh, I fixed it, but I didn't. It's still there.
Oh
It's
man.
it's crazy. One thing that I did read was interesting was vacuuming more frequently, which is good. For most people, they should be vacuuming because it's all in residual dust and everything that you find in your house, right? All chips away. It's all fragmented. So that's definitely something that you need to consider. There's clothing that you can be aware of that it's rough out there because I think everyone's favorite clothing probably has some kind of microplastics, including the stuff I'm probably wearing and you're probably wearing right now. Um,
Well,
so it's
anything that can like theoretically like prevent water from sticking on there, has to contain some sort of plastic item to kind of
or
keep that
endocrine disrupting chemical to like that is, you know, preventing that from doing like anti-flame stuff and
right.
anti-water. It's just so it's hard. The bottom line is it is really, really hard. And I think that if you're listening, there's small things you can do, but
But we're
it's
not trying to be
almost
alarmists. That's right. We're
no, we're
not.
not. We're not. But like I'm still using plastics. I'm
Yeah.
still doing I'm not changing my life significantly, but
Yeah.
I have become more conscious about it. And that sounds like what you are, because it's impossible. It's truly impossible to say that you just can't go around without plastics or plastic exposure to some degree. And even your kids, unfortunately, that's just the
Oh,
way it
they're
is. All
everywhere.
their
They got
toys,
plastic stuff in there.
everything.
Everything.
Yeah. So I don't want to. You're right. It's not to be alarmist, but it is to be more thoughtful, at least in ways in which you can start thinking about doing this. And the good news is that I think with more research, companies are going to start saying like, oh shit, we should probably change this because people are looking. I think it's a
Right.
good business decision because people are going to start looking for non-microplastic exposure,
Absolutely.
non-endocrine disrupting options. And I think that even if they don't care about what the chemicals actually do, I think they understand that there's going to be a massive market going forward for getting rid of these chemicals in the future.
You're absolutely right. Pretty soon, just currently a lot of bottles have like what the BPA, whatever, like there's no BPA in this or, and so
Right.
but again, that's the problem with microplastics. They're so small. How do you filtrate them out? Um,
If
I
they
don't
can
know.
get in my testicle, they can get anywhere. But so you just brought up something. So I do think that it's important that we distinguish the difference here between microplastics and endocrine disrupting chemicals. Now we've talked a lot about endocrine disrupting chemicals, and right along with microplastics, they are a very, very hot topic. So Kevin, let me ask you the question: are microplastics endocrine disrupting chemicals?
So the short answer of it is no, they are not. All right. The endocrine disrupting chemical that we most often kind of talk about are these phthalates. As we
Right.
had on the Dr. Swan episode, we talked a lot about phthalates, where they could be found, and the potential causes on the environment it can. We talked about fake grass, how phthalates are found in fake grass, how that's terrible. So I got rid of my fake grass. But but no, phthalates are not microplastics. But the key thing is that phthalates can be found in microplastic fragments or attached to them. Some of these studies talk about how these microplastics may be a vehicle, and you're basically just have some of these endocrine disrupting chemicals attached to them. But it's important to distinguish that these microplastics themselves are not endocrine disrupting chemicals. Phthalates are a
So
group of oh, go ahead. Oh,
go
yes.
ahead, go.
So phthalates are a group of chemicals that are often added to plastics to make them more flexible, soft, like my fake grass that I loved. They're also used in various fragrances, and they're found in many everyday products, including plastic food and beverage containers, plastic wrap, perfume, nail polish. All kids' toys probably have phthalates to a certain degree, and personal care and household products.
So that's the thing, and I think that that was an important point because while microplastics and endocrine disrupting chemicals are definitely different, they are not the same. Um, there is concerns that where microplastics go, phthalates will follow because Kevin just alluded. The whole point of a lot of these endocrine disrupting chemicals is like phthalates are to modify plastics to make them more usable for a specific purpose. So, but also you're talking when we're talking about microplastics, we're talking about such small pieces. How significant could that little thing be if there is an endocrine disrupting chemical? I think it's hard to say at this point. I don't think we know. Is it, we want to get rid of endocrine disrupting chemicals. We do know it can impact our hormones. And that's something that we didn't even talk about when we're talking about fertility and testicle function, right? Is the impact that microplastics may have on those things. And when you look at it now, saying like, okay, so they are different, but if microplastics are often found to have some endocrine disrupting chemicals, could that be impacting the function of our testicle and our ability to create testosterone and the ability to develop sperm? It's possible. Now, do we know? No, we don't know. I still think the idea of having these things at all in our bodies is not great. I don't think there's anything positive to say about it, but I do think that it's too early on to be like, this is going to be the demise of man. I don't think we're ever going to get to that point. I don't know. What are your thoughts, Kev?
Well, again, the way I'm playing a little bit of devil's advocate here, but
Yeah.
there was a time, just like you pointed out earlier on as we're discussing this, cigarettes were so commonplace, man. They was in the surgeon's lounge, right? Just smoking cigarette, and we didn't think of that as having any long-term effects. Microplastics, phthalates, like these we could be seeing cumulative effects as time goes on. We can't as scientists, Justin, you and I can't think that like things that we have in the environment are completely just not going to have potential negative effects on the body. We can't just assume like, hey, we invented this awesome thing that's going to, give us so much utility in our lives of convenience, right? Plastic at the end of the day is really for convenience to make things cheaper, that it's not going to have potential consequence. That's a little bit like I'm playing a little bit more alarmist
No,
to be a
I think
devil's
you're fair.
advocate.
I think it's fair. It's fair, but um, we've had multiple people on to discuss the declining sperm counts and the data. Both Dr. Smith and obviously Dr. Swan had alluded to endocrine disrupting chemicals potentially playing a significant role in that decline, if you believe it is a decline, and there is significant data suggesting there is. But the microplastics conversation has not really come into that conversation.
Right.
It's really been a discussion of endocrine disrupting chemicals. Um, but it does seem that they may go hand in hand, although once again, microplastics, not EDCs. However, EDCs are often attached to microplastics, so it's not far-fetched to say that, there is a factor involved in that.
As someone who did a lot of mice studies, Justin, I did run over this one study. I want to read it to you.
Okay.
It's interesting. This is interesting. So basically, in mice, they basically fed them water, all right, with polystyrene, PS, all right. And I put that in
A
mice, and I don't know
microplastic.
if the thresholds were appropriate, but it was like 100 micrograms per liter, 1,000 micrograms, 10 milligrams. I actually don't know what thresholds are. They like completely poisoned the mice? I don't know.
Right. That's a
But
good
what
point.
But what they saw after they gave these young male mice this microplastic containing water, that they saw that the ratio of live sperm in the epididymis to the total number of sperm was significantly lower in exposed animals, as well as with morphologically aberrant sperm. Now, we've talked about morphology, how, in common day, a little less kind of impact, but kind of interesting, right?
Yeah. So the epididymises were defective. Is that what you're saying? Explain that again. Say that
No, no,
again.
no. So their finding was that the ratio of live sperm in the epididymis to the total number of sperm was lower in the exposed animals. So the
Ah,
exposed animals, the more
production.
exposure they got, there was lesser sperm. Basically, decreased sperm count, mature sperm in the epididymis.
And like we said, that's the holding spot for sperm to mature. So, less sperm there means we're probably making less sperm in the testicle. Um, yeah, that's concerning,
That
obviously.
was a cool model. So
It's a very simple study. Obviously, not all animal studies translate to
right,
human, but
right.
this is obviously, a pretty straightforward one. Doesn't mean that that's exactly true for humans. We don't have data to confirm that translates to that. But it's definitely concerning. Exposure rates directly impacting the ability to create sufficient sperm in a testicle of a mouse, definitely is something that I think is going to be looked at a lot in humans in the next few years for sure. I think we've been gone pretty in depth here, and I think we've had kind of a really good back and forth with the data, with what we think about the data, our interpretations, and how these things can be impacted. Now, any final thoughts on what this all means, Kevin? Like, what does this all mean? What does microplastics mean on, and how does microplastics at the end of the day impact men's health?
Well, from my perspective, I think we're still rather early on. So nothing concrete. Again, what we talked about. I think just being a little bit more cognizant. We are finding that there is potential impacts in the testis. All right. Again, I think we need a lot more evidence there before we can draw really concrete conclusions. But again, it's be cognizant that this potentially could be something that we learn much more about in the next coming years. And if we learn that this is all cumulative, we talk about how, like, hey, everything you do in terms of when you're trying to conceive, you got 3 months, you got 72 days. So if you've been in that hot tub every day, well, starting today counts for 72 days later from now. So
Right.
again, I'm not trying to be alarmist. I'm just saying, hey, just something to think about. That's what all this is for, just to kind of get, just don't take everything as if it's going to be, it's all right. That's all. How about you, Justin?
Right. I think in a world, in a day and age where everyone is so transfixed on their testosterone levels, their sperm count, everything's declining. We're less manly men than we've ever been. Testosterone levels are lower than they've ever been. Sperm counts are lower than we've ever been. Is it because of what we're doing? Is it because of how we're acting? And is it because of all these other factors? And I think that we've talked at length about a lot of the things. We've never been fatter. We've never been eating more shit than we are eating now. We've never been more sedentary as a society. But there are other aspects of it that we have yet to focus on. I think people are starting to get wise on endocrine disrupting chemicals.
Mm-hmm.
They're starting to get wise on potentially microplastics. And as you alluded to, detection does not mean cause by any means. However, detection in the testicle, which is a place that we had already established as a safe space for your testosterone to develop and your sperm to be created, is concerning. And when you have exposure in an area that shouldn't be exposed, we start to worry about potential implications of that. And we're not there yet, and I'm sure we will start discovering more in the next few years. But I think being mindful and thinking about your exposure to endocrine disrupting chemicals, thinking about your exposure to microplastics can never be a bad thing, because what we don't want in our bodies is foreign things that shouldn't be there. And at the end of the day, I think that we can all agree with that. So I don't think that we're here to fearmonger. We're not here to strike the fear of God in you that microplastics are the devil and all plastics are the devil, because we don't know. And I'm sure we're going to continue using plastics in some capacity for a very long time. But understanding exposures, understanding what it can potentially do to us is important. And we're going to keep exploring that. So I think this is going to be a conversation we're going to see over and over. It's going to be continuously in the news over and over in the next few years.
Very well said. And look, there's data. We Justin, you and I, we focus on the testes, we focus on penis. But man, when I was looking at this data, looking at it in colon cancer and its association, that I'm just saying.
Yeah, I hear you. And then I'm sure they're going to start looking at it in prostate cancer and things like that. And it's all inevitable and it's all important. And it's all important to see, because I think that certain exposures to certain things in certain parts of the body, we know can potentially cause cancer in one part of the body that doesn't cause cancer in another part of the body. So just because the presence may not impact the testicles doesn't mean it's not going to impact your liver or your colon.
Right.
We just don't know, and we just need to do the research. All right, I think we should wrap it up with that. Yeah. What do you think, Kev?
I think so.
All right, guys. Thanks for listening as always. We are trying to ramp up all our socials. We're trying to do more there. So feel free to follow us on all socials, TikTok, Instagram, Twitter, @TheManUpPod. You can follow us on YouTube, and hopefully you're watching this on video there. You can follow, subscribe, give us a comment, give us a review. And you can always listen to us on all podcasting platforms, including Spotify, iTunes, and Amazon. So thanks as always for listening. Until next time, have a good one.